Hello, everyone. My name is Franklin. I'm one of the two co-founders of NorCal SCI. Welcome to today's presentation on electrical stimulation. On behalf of my fellow co-founder, Nick Struthers, we welcome you. So these presentations are made possible through a generous grant from the RE Foundation, and it's part of our NorCal SCI Virtual is a New Reality series. So very happy to have all of you on this call. Just so that you know a couple of things, you have all been muted so that we don't have any sort of background noise distractions during the presentation. If you have any questions, or two ways for you to pose them. One is by using the chat feature that's located sort of towards the bottom of your screen, and we'll answer all the questions at the end. Alternatively, you can also email them to us at info@norcalsci.org, and again, we'll get to them at the end of the presentation. So our objective is to get to be done in about an hour's time. So a couple of other things, as you may or may not know, there are some rolling power outages here in California. So we've taken every measure possible to ensure that if the point of origin of this broadcast is disconnected because of a power outage, that there's a backup. So don't be startled if something happens. Hopefully nothing is going to happen during the next hour, okay? And then the second thing is we're recording this presentation. So at any point, if you need to leave, don't worry about missing out on anything. As long as you've registered for the presentation, you would receive an email from us probably Monday or Tuesday with a link to the recorded version of this presentation. So that's everything that I wanted to share. So let's just get started. I'm happy to introduce our presenter, Jennifer Kapetanic. She received her doctorate degree in physical therapy from Chapman University in 2008 and has 12 years of experience as a physical therapist. For the last 5 years, she has been part of the therapy team at the Spinal Cord Injury Rehabilitation Unit at Santa Clara Valley Medical Center in San Jose. It's one of the premier spinal cord injury rehab hospitals in all of the country. She has advanced certifications in exoskeleton and functional electrical stimulation use with hundreds of hours of clinical application across spinal cord and other neurological injuries. Her clinical skills have been developed across many areas of PT, including acute care, cardiac rehabilitation, orthopedics, and again, most recently, spinal cord injury rehabilitation. So it's my privilege to present you and introduce you to Jennifer. Jennifer, go ahead.
Thank you. Good morning. Thank you, everybody, for joining me this morning. Thanks for the introduction, Franklin. When Franklin reached out to me to talk about electrical stimulation, I thought it was really important to give background on what electrical stimulation is, and also kind of what normal muscle does, and then what happens after spinal cord injury. So this session, this is one of 6, this will kind of be a background on normal muscle, what happens to muscle after spinal cord injury, and an introduction to electrical stimulation. So we will talk about the basics of electrical stimulation. We will talk about normal muscle contraction and normal sensation. And then we will talk about the effect of spinal cord injury on these two things, muscle contraction and sensation. Then I would like to go on to how electrical stimulation can be used in the spinal cord injury population, the benefits of it, but also the safety precautions when using electrical stimulation, because there are a lot of safety precautions that we have to take into consideration. So let's start with the basics. How does a normal muscle contract, or how does normal sensation occur in the body? So before the spinal cord is damaged. The nervous system consists of 3 different parts. It consists of the brain, the spinal cord, and the peripheral nerves. The peripheral nerves are the ones that kind of leave the spinal cord and go out into the body to connect to the arms, the trunk, the legs. These nerves have a sensory component, so the ability to feel things like pain, temperature, light touch, where your body is in space. And then there's the motor nerves. Those are the ones that supply the muscles and actually allow you to contract the muscle and use the muscle. In the diagram here on the screen, you can see the brain and the spinal cord, and then you see all the little nerves coming out of the spinal cord. So generally the cervical spine is that first part of your spinal cord, and those nerves are the nerves that head towards the muscles and sensation in your arms. The thoracic spine is the blue component that you see there. Those nerves go to your torso and your trunk. The green component is the lumbar spine, which sends nerves down to the legs and the feet. And then the sacral component is the red portion down there. Those nerves go to bowel, bladder, and sexual function areas. So let's keep going. How does a normal muscle actually contract? So the nervous system is split into two different areas. We would consider it the upper motor neuron area and the lower motor neuron area. The upper motor neuron area consists of that brain and the spinal cord. So those two areas work together to make an upper area. The lower area is all of those little nerves that come off of the spinal cord and go directly to different parts of the body, like we just discussed. There's an interesting component within the spinal cord. So somewhere around T12 to L3, and it totally depends on the individual because anatomically it's a little bit different in everyone. The spinal cord turns from a cord into what you can see as a bunch of little nerves. So the spinal cord, somewhere between T12 and L3, changes from an upper motor neuron to a lower motor neuron. This may seem irrelevant right now, but I will talk to you about it a little bit later within the presentation and why this is so important when we're using electrical stimulation. So now that we have that out of the way, let's figure out how a normal muscle contracts. So a signal is always generated in the brain. The brain then sends that signal and it travels down the spinal cord. The signal exits the spinal cord at the peripheral nerve at the level of the function. And the peripheral nerve sends the signal to the muscle and the muscle contracts. So that seems confusing. So let's use an example. So say I want to bend my elbow. I would start with that signal starting in my brain, and my brain would tell my spinal cord, hey, I want to bend the elbow. And then bending of the elbow generally happens around the C5 level of the spinal cord. So at the level of C5, the nerve would then bring that signal to the muscle, and then my bicep would contract and my elbow would bend. So what happens after you have a spinal cord injury? After the spinal cord is damaged, usually the brain and the peripheral nervous system are still intact. This is not always the case, and there are instances when there is brain injury during a spinal cord injury, and there's also injury to the peripheral nerves. So if during a spinal cord injury, somebody hits their head, has a concussion, that can also alter what's going on in the brain. The other thing that can happen a lot during spinal cord injury is broken bones along with the spinal cord injury in terms of fractures in the arms and the legs. If one of those peripheral nerves that goes down to the arms and the legs is damaged, then that peripheral nerve may not be intact either. What happens is the damage to the spinal cord prevents the signal from the brain from traveling to the muscle. So the brain, if it's intact, is telling the spinal cord what to do, but there's kind of like a roadblock at the level of the spinal cord, and that signal can't get past that roadblock to the peripheral nerve to actually tell the muscle to contract or to tell the body, this is what I'm feeling, this is the sensation that I'm feeling. So in the example that I just used in terms of bending the elbow and contracting the bicep, my brain is telling my spinal cord, hey, bend my elbow, use my bicep, but that signal can't get out of the spinal cord. The nerve and the muscle, they're ready to get that signal, but that roadblock at the spinal cord prevents that action from actually occurring. So now that we kind of have a basis of what the nervous system is and how it is altered in a spinal cord injury, I want to very quickly introduce what is electrical stimulation. So electrical impulses are generated from an external device and allow for muscle activation or contraction. We use electrodes that are placed over the skin and connected to an external device. The external device sends electrical impulses through the electrodes and delivers the impulse to the peripheral nerve. So this electrical impulse, depending on how strong it is and what the parameters are, can either cause sensory stimulation or motor stimulation. So from a sensory standpoint, we talked about, again, that pain, light touch, where your body is in space, and that motor stimulation of actually contracting a muscle and allowing that muscle to fire and a part of the body to actively move. So how does electrical stimulation work after the spinal cord is damaged? In the picture on the screen, you can see that there's two different damage areas in this picture. There's a damage to the brain, which would happen in stroke patients. And then there's a damage to the spinal cord, which would happen after a spinal cord injury. So we're looking at the fact that we can't get that signal from the spinal cord down to, in this picture, what's called the motor nerve. So you can see that the electrical stimulation device, the little black box that's kind of down on the bottom of this picture, it has two electrodes that are attached directly to that motor nerve. So electrical stimulation bypasses the brain and the spinal cord, and it sends an impulse directly to that nerve, which can then stimulate the muscle or the sensation that we're asking it to. So it bypasses kind of that roadblock in the spinal cord and goes directly to that nerve. So I kind of alluded to this earlier, but I was mentioning the difference between the upper motor neuron and the lower motor neuron system in the nervous system. And I mentioned that for electrical stimulation to work, the lower motor neuron system needs to be intact. So again, just to go back to the picture on the screen, the spinal cord is an upper motor neuron system. So if it's damaged, it's okay. But if the nerves are damaged, that's when electrical stimulation may not be successful. Again, I mentioned that the spinal cord turns into peripheral nerves anywhere from T12 to L3 in individuals. It's really hard to diagnose this in terms of, am I an upper or am I a lower motor neuron injury? But that peripheral nerve must not be damaged in order for electrical stimulation to work after spinal cord injury. So how can you figure out if you have an upper motor neuron or a lower motor neuron injury in your spinal cord? If your spinal cord was damaged, C1 to T11-ish, it's a pretty good solid plan that you do have an upper motor neuron injury and that your peripheral system is intact. It starts to get gray again around the T12 area. It's not something that can be diagnosed by MRI, looking at an X-ray. It's more about symptoms and how your body is reacting kind of in other areas of the body. So I have some signs on the screen that the lower motor neuron is damaged. So flaccid paralysis. So paralysis is weakness, and flaccid means that there's really low tone or no spasticity. So generally somebody who has damage to those peripheral nerves has much less tone in their legs, and they don't exhibit spasms. Also, the absence of reflexes. So if the upper motor neuron is damaged, the spinal cord itself, generally people have very active reflexes, hyperreflexivity reflexes. If the lower motor neuron is damaged, those reflexes actually disappear and they become absent. Another sign of lower motor neuron damage is muscle fasciculations, which is kind of like a fluttering of the muscle. It's not an active contraction of the muscle, it's just the muscle kind of fluttering every once in a while and then relaxing. Some people always ask, if my injury is incomplete versus complete, does that matter in terms of whether I'm an upper motor neuron or a lower motor neuron injury? And it does not. So the completeness of your injury doesn't change where that damage was done in your spinal cord. So if you are a complete L2 versus an incomplete L2, you still probably have damage to the lower motor neuron system, and the electrical stimulation likely won't cause the effect that we're looking for because those peripheral nerves are damaged. So let's talk about what the benefits are of using electrical stimulation after a spinal cord injury. There's nothing in the research, I want to start with this kind of caveat, that there's nothing in the research that shows that using any sort of electrical stimulation can help the recovery of the spinal cord injury or damage itself. The majority of the benefits of using electrical stimulation are for those secondary effects that occur after a spinal cord injury. So spinal cord damage is one of those things where your spinal cord is injured and it takes away your ability to function in terms of arms, legs, bowel, bladder, those sort of things. But then there's also this kind of sequelae of events that happens in terms of other issues with the body, in terms of pain management, hypersensitivity, the muscle shrinking, things like that. So electrical stimulation really targets these issues, and it benefits kind of the secondary effects of the spinal cord damage. There is a lot of research being done to see if electrical stimulation can improve a spinal cord damage in terms of at the actual site of the spinal cord, but that has not, really gotten through the research phase right now. So what are the benefits of using electrical stimulation? The first one is pain management. So after a spinal cord injury, the body's way of telling you that something's going on or that something is injured is pain, and it can be felt in multiple ways. It can be a musculoskeletal pain, it can be a nerve pain, and so electrical stimulation can help decrease these sensations and kind of slow them down so that they're kind of under the radar during the day when the electrical stimulation is being used. Electrical stimulation can also benefit hypersensitivity. So sometimes when the spinal cord is damaged, people feel a heightened sense of sensation in their body. And this can be pins and needles, it can be the sharp shooting pain that you feel. And electrical stimulation has been shown to kind of offset that feeling and slow it down by decreasing the brain's ability to react almost to that hypersensitivity that you have. Electrical stimulation can be used to maintain or increase range of motion by allowing lengthening of the muscle and also decreasing kind of the tightening or stiffening at the specific joints that happen. It can also prevent muscle atrophy, which is wasting of the muscle. So the picture on the screen right now shows a normal bicep and then an atrophied bicep. It is much smaller than the other picture. Electrical stimulation can help decrease this kind of shrinking of the muscle. And then it can also help to re-educate a muscle. So in terms of preventing the muscle from shrinking, this is generally a muscle that can't be used. So an area of your body that doesn't work after your spinal cord injury. Muscle re-education is if you have an incomplete injury or you have a muscle that's starting to fire, but it's very, very weak. You can use electrical stimulation to help re-educate this muscle on what its job is and hopefully get it functioning a little more normal. So what are the other benefits of using electrical stimulation? When electrical stimulation is used in a functional way, it can help provide cardiovascular conditioning. So anytime a muscle is contracted, it helps increase kind of the pressure on the heart and the lungs. It makes those organs work harder, which helps to improve your cardiovascular conditioning. So using electrical stimulation can, in a sense, help your heart and your lungs stay strong. It can also increase local blood circulation. So before a spinal cord injury, when a muscle contracted, it helped to kind of push on the veins in the body to help circulate the blood and get it back to the heart. After a spinal cord injury, if those muscles aren't contracting, the blood tends to pool in those areas and the circulation decreases. So by using electrical stimulation on some of those muscles, you can contract the muscle and allow for improved blood circulation. So this a lot of times is seen kind of in the hands and the feet in the body. A lot of times people can use electrical stimulation around the forearms or the wrists or the ankles and the calves so that they can get some of that fluid out of those areas where it tends to hang out more and get it back into the circulation system. Electrical stimulation can also maintain or increase bone density if it's used in the right way. So just like with the blood circulation that we talked about, when a muscle contracts before a spinal cord injury, it pulls on the bone. And this tension or pull on the bone is actually what increases or improves or maintains the density, the strength of that bone. So after a spinal cord injury, if those muscles are no longer firing and contracting and pulling on the bone, what we can see is a decrease in bone density. So the bone gets weaker. And over time, this can lead to pathological fractures. It can lead to poor healing, things like that. So if we're using electrical stimulation and actively contracting that muscle on the bone, then we can maintain or possibly increase bone density. The other benefit of using electrical stimulation is managing muscle spasticity or tone. So after spinal cord injury, the resting tone of the muscle changes. Again, if it's an upper motor neuron injury, we see a lot of hypertonicity, so extra tone kind of throughout the body, or the spasticity or spasms that people generally tend to call it. Electrical stimulation can be used to minimize some of these pathways to decrease the spasticity and the tone that's happening throughout the body. So all of these benefits that I've listed, the ones on the previous screen here in terms of pain management, hypersensitivity, range of motion, the muscle atrophy, and the muscle reeducation, along with the 4 that I just spoke about, there is plenty of research out there to show that these are beneficial in the spinal cord injury population. The type of electrical stimulation, though, that provides these benefits varies. And in the next session, I'm going to be talking about the different types. And so what I want to be clear with now is that not every type of electrical stimulation will provide these benefits. So this is something that we'll kind of go into further down the road in the upcoming sessions, so you have an idea of what type of electrical stimulation you would actually need to use if you're looking at gaining any of these benefits. So now that we talked about the nervous system and we talked about how a spinal cord injury limits the ability of the muscles and the sensation to be normal, and we also discussed the benefits of electrical stimulation, let's talk about when it's not safe to use electrical stimulation. I want to throw something out there right away that if you have not used electrical stimulation, this list is not all-inclusive, and I would definitely recommend that you speak to your medical practitioner to get clearance to use an electrical stimulation device. I'm going to list off some of the absolute contraindications when you may not use electrical stimulation. But again, there may be something that's not on this list that a physician or a physical therapist may say, no, I don't think you should use electrical stimulation at this time. So what is the list of the absolutely nots? Implanted cardiac pacemakers, defibrillators, or any other implanted stimulator that you have in your body. If you have something in your body that's already sending electric signals to some organ, the electrical stimulation may interact with that and may cause an issue. Electrical stimulation is not safe to use during pregnancy. There have been very few studies done on this because a lot of people aren't willing to participate in this study, but they have shown that it can change in contractions or kind of the sensitivity during pregnancy. If you have an unhealed fracture or a muscle or tendon tear, it is also not safe to use electrical stimulation. So as I mentioned earlier, using the stimulation to contract the muscle, it can cause a pull on the bone or the tendon. If you have an impairment or an injury to the bone or the tendon, that pull of the muscle from the electrical stimulation could actually decrease kind of the healing of those fractures and tendons. If you're using electrical stimulation on your arm and the unhealed fracture or the tendon tear is in your leg, you may be okay. You want to just get that cleared by your doctor, but you definitely don't want to use the electric stimulation directly over an unhealed fracture or a muscle or tendon tear. If there's a history of epilepsy, either before or after the spinal cord injury, it is not safe to use electrical stimulation. Same thing with malignancy. So if there's any cancerous tissue in the body, if your spinal cord injury was caused because of a spinal cord tumor, or you have in the past had cancer somewhere else in your body and then had the spinal cord damage, it is not safe to use electric stimulation. So what happens with the cancerous tissue is using electrical stimulation, we talked about on the previous slide, can improve circulation. And what studies have shown is that it can actually improve circulation so well that it's spreading this malignancy or this cancerous tissue through your body. So active cancer is an absolute contraindication to electric stimulation. If you have cancer in the past and now you're cancer-free, that is something where I would definitely, again, have you talk to your physician to make sure that they feel comfortable with you increasing the circulation in your body before you go and use something like this. Another reason when it is not safe is if you have open wounds or damaged skin. So we put the electrodes directly on the skin when we're doing electrical stimulation. If you have an open wound or any sort of damage to that skin, whether it's a burn or any other superficial skin issue, it can definitely make it worse by putting the electrode on and sending an electrical impulse through that area. So you want to make sure that the skin that you're putting the electrodes on is healed and intact. Again, like we talked about with the fractures and the muscle tendons and tears, if you have a wound on your foot and you're doing electrical stimulation to your arm, you should be okay because the skin on your arm is intact. But again, just check with your medical provider to make sure that they feel comfortable with that. Another reason you would not want to use electrical stimulation is recently implanted plates, screws, or other hardware that you may have in your body. So in terms of the research, the recently implanted part is 3 to 6 months generally. They don't want you to use electrical stimulation when you have recently implanted hardware because it may cause poor healing of the bone around that hardware. The electrical stimulation can kind of pull or tug on any of that hardware that was placed in your body and prevent it from really hardening and healing in the body. The other reason is is when you put electrical stimulation on your body, it can produce some heat and warmth. And if you have a recently implanted piece of hardware in your body, all that stimulation is going to kind of be pulled to that hardware, and it may cause a burning of your skin because the stimulation isn't being spread through the whole electrode. It's being kind of pulled to that piece of hardware. Generally, after 3 to 6 months, everything has healed around that hardware, and they say that it is safe then to use electrical stimulation over an implanted piece of hardware. The last one on this list is over the front of the neck, or the carotid sinus. So that's all of kind of those structures in the front of your neck that bring blood to your brain and your head. So it is absolutely not safe to contract any of those muscles using electrical stimulation. So the list that I just went over were absolute no's in terms of using electrical stimulation. This list that I'm going to show you here are items where if something on this list is happening in your body, you should definitely consult a physician prior to using electrical stimulation. So I did mention that electrical stimulation can help decrease spasticity. But if you have severe spasticity, or you actually have contractures in your body because the spasticity is so strong, you definitely want to talk to the doctor first about using electrical stimulation over that area of your body. Another area that you want to be really careful about is heterotrophic ossification. So this is something that happens in spinal cord injury, generally after a traumatic spinal cord injury, where the body starts to lay down bone in your joints. And so a lot of individuals after an SCI have heterotrophic ossification in their hips. It's a really common area to get this HO. And if you have heterotrophic ossification in your hips, you don't want to give an extra force to that area because it may cause more damage to the joint. So this is something that you would want to run by your physician before you used electrical stimulation. If you have severe osteoporosis, this is also something that you would want to talk to your physician about. Again, I mentioned that electrical stimulation can help to improve bone density or decrease the risk of osteoporosis. But if you already have significant osteoporosis, by contracting the muscle, it may cause small fractures or tears in the bone because that bone is not strong enough to take that contraction of the muscle. If you have joint contractures or limited range of motion, kind of like what I was talking about with the severe spasticity, you would definitely want to talk to the physician before you put electrical stimulation on any of these areas. If you have a baseline or a new cardiac or respiratory disease or instability, this is something that you would want to talk to your physician about. Using electrical stimulation, again, helps to improve the circulation. It can put some stress on the heart and the lungs. And so if your heart and your lungs are already impaired, we wouldn't want to put extra work on them from electrical stimulation. And then active infections, in terms of if you have a urinary tract infection, if you have a respiratory infection, you don't want to use electrical stimulation during an active infection. You want to make sure that that infection is treated and gone, and then it would be safe to use electrical stimulation. Again, this kind of goes over the same idea of the why you can't use stim with cancer. With active infections, if you use electrical stimulation, it can increase the circulation in your body and possibly take that infection from one area and spread it to another and make it worse. So this list, again, these aren't absolute no's, but these are all things that you would want to talk to your doctor about before you used stimulation. So what needs to be monitored during electrical stimulation? Your skin integrity is very important. The electrical impulse that you're sending through your skin may make your skin warm to the touch. You can see the picture on the screen that you can tell exactly where that electrode was on that person's body. There's a nice red square there. Electrical stimulation does cause short-term redness, and it may make the skin warm. It's okay if this is short-term, but you don't want this to last long-term. So if this is there for an hour or two, it's okay. But if it's there for longer amounts of time, we would need to look at the settings that you're using and maybe change those because they're probably too high, causing possibly skin damage. The other thing that needs to be monitored during the use of electrical stimulation is your blood pressure. So if I put electrical stimulation on my leg right now, my sensation is completely intact. I can feel everything. And as I started to turn it up, it would be very painful for me. In spinal cord injury, we actually take advantage of the fact that the sensation is decreased, and we can turn that stimulation up higher, which allows for that active contraction of the muscle. Once the sensation is not intact, the pain isn't felt, but the body may still respond to that painful stimulus, and your blood pressure may rise. So if you are using electrical stimulation over an area that you cannot feel, you do have to be aware of your vital signs, your heart rate and your blood pressure. This is where autonomic dysreflexia really comes into play also. So if your injury is at the level of T6 or below, T6 or above, I'm sorry. If your injury is T6 or above, you are at risk for autonomic dysreflexia. And what this is your body reacts to a painful sensation that you may not be feeling. So in the picture, there's a bunch of pictures of what may cause AD. Restrictive clothing, full bladder, pressure areas. If your bowels are full, you can add electrical stimulation to that list. So your body can feel it, but your brain doesn't know that you're feeling it. And so your body reacts and the blood pressure starts to go up. Autonomic dysreflexia is a medical emergency. So if you turn the stimulation off and your blood pressure doesn't go down, you should seek medical attention very quickly. What are the signs of autonomic dysreflexia? Increased blood pressure, and it goes up very quickly. A flushed face, headache, distended veins in your neck, the front of your throat, sweating, and sometimes people get little like goosebump sensations also. So if this is happening during the use of electrical stimulation, you would absolutely want to stop the stimulation, monitor your blood pressure, and if it doesn't come down, then seek medical attention. You also want to monitor how hard you're working during electrical stimulation. So again, I mentioned that your heart and your lungs can be put to work when you're using electrical stimulation. So you want to monitor your muscle or general fatigue levels, any shortness of breath that is happening during the use of electrical stimulation, and what we call your rate of perceived exertion. So how hard you feel like your body is working. When you're using stim, you really shouldn't be higher than that 4 to 5 or that green kind of area on that scale that's on your screen right now. So you can exercise for long periods of time. You're able to talk and hold short conversations. That stimulation isn't putting a lot of stress through your heart and your lungs. So just a really brief summary of what we went over. We talked about normal muscle contraction and sensation and how it's impaired after spinal cord injury, how electrical stimulation can be used after spinal cord injury, the benefits of electrical stimulation, but also the safety and medical concerns that can arise with the use of electrical stimulation. I'm going to skip that slide really fast, just a really brief what is coming next in this series. So it's a 6-session series. Next time I'm going to talk about the types of electrical stimulation. And then session 3, 4, and 5, I'm going to kind of go into each of those benefits and the different types of electrical stimulation and how they can provide you those benefits. And then the last session, we will talk about research that's happening in terms of indwelling stimulation.
Okay. Thank you so much, Jennifer.
Welcome.
Boy, what a way to tease the audience with the next 5 sessions, so that everyone knows the next session is going to be 5 weeks from today, and we'll notify you in the email that you're going to get with a link to today's recording. So let's jump right into questions, and there are a whole bunch of them, Jennifer. So
Okay.
get ready.
All right.
Okay, I have more than moderate ankle swelling. Can the stimulation be used to reduce the swelling? If so, where do I locate the electrodes?
Yes. So you can use electrical stimulation to decrease swelling. In some of the next sessions, I will talk about more where the electrodes can be placed and some of the settings and specific devices that you would use to kind of treat that. But yes, electrical stimulation can be used to treat localized swelling, and the ankles and feet are a very common area.
Okay. Can I use stim if I have a baclofen pump?
So the research out on this is very questionable, and a lot of times different physicians have different ideas of whether it's safe to use the stim or not. Many physicians say that you can use it away from the area where the baclofen pump is implanted, but there are some physicians who say no. So this, I would refer you to your physician and ask them if you are cleared to use electrical stimulation.
Okay. How can you tell the difference between fluttering of the muscle and an actual contraction of the muscle while using an FES bike?
So using an FES bike is functional electrical stimulation, and we will talk about that in the 5th session of this series in terms of how to really use the settings on the FES bike to get a good contraction and get away from that fluttering, because the fluttering is something that you don't necessarily want. You want to see a good strong contraction through the muscle.
Okay. Do you approach an upper motor neuron injury differently than a lower motor neuron injury when using stim?
You do. So if you have a lower motor neuron injury, you may not actually receive any of the benefits from the stim, because your peripheral system, those nerves, aren't necessarily intact. And for electrical stimulation to actually work well, they need to be. So if I'm an upper motor neuron injury and I put electrodes on my bicep and I turn the stim on, it should contract my bicep. If I'm a lower motor neuron injury and I put those electrodes on my quadricep, that muscle on the front of my thigh, I may actually not see anything happen, because that peripheral nerve, that nerve that goes to that muscle in my quadricep, is damaged, and I need that nerve to be healthy in order to use the benefits of the stim.
Okay. Are there any special considerations that need to be taken into consideration when using stim on a child?
So stimulation is safe to use on a child. They absolutely need to be able to give you feedback. So being cognitively intact and have the ability to communicate is very important, because if something is hurting them or something is causing them some sort of discomfort, they need to be able to pass that along to you. The same contraindication list would be for a child as an adult that I kind of mentioned in terms of the absolute no's, and then when you would need to contact the physician before it was safe.
Okay. So I know we're going to be talking about this in the upcoming sessions, but can you tease our audience a little bit about this dilemma, or not dilemma? There are so many stimulation devices out there on the marketplace.
Yeah.
And especially you go to Amazon and you type in, electrical stimulation, will have 500 of them. What is the difference between what's out on the marketplace, open marketplace, versus sort of the more sort of rigorous devices?
Yeah. So there's kind of 3 areas of electrical stimulation if you think about it. There's TENS, which a lot of people see on Amazon. You can easily purchase those online. A TENS unit, TENS, just provides mainly sensory stimulation. So it doesn't provide active muscle contraction or stimulation. The other kind of device that you may see on Amazon or online that you can just purchase on your own is an NMES unit, neuromuscular electrical stimulation unit. These units have a little more juice and power to them, and they can provide active muscle contractions, but nothing that's going to significantly move your body against gravity. So if I put an NMES on my bicep, I'm going to notice that the muscle contracts, but it may not be enough power or juice to actually bend my elbow and contract my bicep that much. The third area of electrical stimulation is functional electrical stimulation, FES. These you will not just find online. These require a physician's order and a letter of medical necessity, generally from a physical therapist. And what this device does is it contracts multiple muscles in a pattern in terms of riding a leg bike, riding an upper extremity bike, using it in kind of a rowing fashion or something like that. Those require physician's referral, and you can't just purchase online.
Okay, thank you. All right, next question. When you're actively contracting muscles, for example, using an RT 300, specifically quads, glutes, and hamstrings, would this help with bone density?
Yeah, so an RT 300 is a functional electrical stimulation bicycle. It's one of the bicycles that's on the market after you have a physician's referral. And yes, using that sort of cycle regularly with contraction to your quads, glutes, and hams could improve your bone density. Again, it doesn't improve the bone density of your entire body. It just improves the bone density through those bones where the muscles are contracting. So that would be mainly your femurs in that area, the upper bone of your leg.
Have there been research sort of in that area that you know of?
There's a lot of research there, absolutely. So I can provide resources if anybody's interested in terms of research, but there are plenty of research articles that do state that regular use of FES, especially the leg bike, can improve bone density.
Right. Okay. Would a heart valve surgery preclude use of electrical stimulation?
No, not necessarily. So that is something that you should be okay with. But again, I would recommend just talking to your doctor, but usually it would be safe. You're not putting the stimulation directly over your heart. And if you have the heart valve and your circulation is generally stable and okay, then it should be safe.
Okay. I've had an FES bike for 3 years. I had a cardiac pacemaker installed in January. I asked the doctor and the pacemaker rep if the FES bike could still be used after the pacemaker installation. They both said yes.
Yes.
And I've used the bike weekly ever since. Is that common, do you think?
It depends what type of pacemaker you've had placed. So if it's a demand pacemaker, then generally they say no, but there are pacemakers on the market now that are safe to use with electrical stimulation. So speaking to your physician was absolutely the right thing to do. And if they okayed it, then I would say that it's absolutely safe to use.
I have more than moderate ankle swelling. Can the stimulation be used to reduce swelling? If so, where do I locate the electrodes?
I think we started with this question.
Oh, did we? Okay. I'm
but
sorry.
I can do it again if we need.
No. Some kind of a host I am, huh?
That's all right.
Okay. And how does STIM interact with the central pattern generator for an upper neuron injury?
Yeah, so in terms of the pattern of an upper motor neuron injury, generally what happens again is the brain tells the spinal cord tells the nerve, and the nerve tells the muscle. The stimulation provided to the nerve that causes the muscle to contract, it doesn't go back the pathway to give the message back to the spinal cord and back to the brain. So a lot of people have this idea that by putting stimulation on my quad, I'm sending that message back through my upper motor neuron system, through my spinal cord, back to my brain to kind of help wake it up or something like that. There's no research that shows that that occurs. When you're using electrical stimulation, you're really using it for those secondary benefits that I talked about in terms of improving the circulation, decreasing the muscle from shrinking, things like that. But there's nothing that shows at this point in time that that signal can go back up through the spinal cord to the brain and provide that pattern that you would be looking for.
Is there any benefit to just sensory stimulation for a lower motor injury?
That's a really good question. There is a lot of research that's coming out that's showing that you can use TENS units and low-level NMES on a lower motor neuron injury to help with hypersensitivity and pain management. You do have to be very careful though with some of the skin issues. Generally with a lower motor neuron injury, you have to increase a lot of the settings on these devices. And the higher those settings go, the likelihood of causing some burning or some, redness or warmth at your skin level does increase also. So there is new research that's coming out. Definitely in the last 10 years, they've really started looking at how STIM can be used on lower motor neuron injuries. But there are definitely more things you have to take into consideration if you are a lower motor neuron injury.
And staying on that element, are there any alternative treatments for lower motor neuron damaged individuals that can have similar benefits?
I don't know of anything specific. They are doing research in some of the very early stages in terms of implantable devices of stimulation to kind of see if they can get some contraction, some stimulation to the lower motor neuron. But in terms of superficial electrical stimulation, meaning putting it actually on the skin, on the body, currently there is nothing else kind of that would take its place.
Is there a particular number of years post-injury where the benefits are not there?
Yeah, it's a really good question. The sooner you use stimulation, the quicker you're going to see the results in terms of these benefits that we've talked about. So if I'm injured, 6 months ago and I start using the stim versus if I was injured 6 years ago, it may take some time for you to actually see the benefits, right? My bone density 2 months after a spinal cord injury hasn't decreased a ton, whereas if I've been injured for 20 years, my bone density has decreased significantly. So you can absolutely use stimulation any time out from your level of injury, but I do think you see much quicker results in terms of the benefits if you start using it closer to your time of injury.
Okay. Does electrical stimulation increase or decrease tone?
It's a good question. So usually electrical stimulation helps to decrease tone. So tone is an abnormal firing of the muscles. It's not something that's volitional. It's not your brain telling your spinal cord, telling your muscle to contract. It's kind of almost like a short circuit within the nerve causing the contraction. So the research shows that putting electrical stimulation on something that has a lot of tone can help overpower that abnormal contraction and actually decrease the tone in that muscle. Now, that being said, I have seen that I've thrown electrical stimulation on people right after spinal cord injury, years down the line from spinal cord injury, and there are those individuals where I slap electrical stim on them and their leg or their arm goes crazy. So in general, it should decrease it, but I'm not going to say that that's 100% true because I have seen it go the opposite way.
Okay. What about potassium levels and electrical stimulation? Does it have an effect on potassium levels in your blood that you know of?
I do not know anything specific from that. There's no contraindications in terms of checking your potassium level before you use electrical stimulation. So based on that, I would assume that it shouldn't have any significant, issue, but I don't know for sure.
Okay. Next question. I'm a T12. How would I determine if electrical stimulation might work on me?
Yeah, good question. So a lot of times you can determine if you're an upper or lower motor neuron based on kind of those other symptoms that we talked about. So if you think about being a lower motor neuron, if your body is very low tone and you don't have spasms, for your bowel and bladder, if you do manual evacuation for your bowel, those are generally indications that you're a lower motor neuron. Also the absence of reflexes. So if the physician, hits that tendon right under your knee and your leg doesn't go anywhere, that means your reflexes are really low. And that would probably mean you're a lower motor neuron. If you're an upper motor neuron, you might have spasticity, increased tone. And in terms of bowel and bladder management, you would usually do dig stim and you would do ICP or some sort of way to empty your bladder. So it's more about looking at those characteristics that you can determine if you're an upper versus lower.
Okay. You talked about this during your presentation in terms of things not to do, and that is not to use stimulation over sort of pressure sores.
Yeah.
This person is asking, can it be used around the area of pressure sore to sort of stimulate the muscle?
Yeah, that's a good question. There's a lot of research that's starting to come out on low levels of electrical stimulation and wound healing. You obviously, again, would not want to put the electrodes right over any sort of wound, but there is research that shows that to improve wound healing, you need improved circulation. So it may be safe to use electrical stimulation at low levels around a pressure sore. But again, I would refer you to your physician to make sure that they feel comfortable with you using stim around that sore.
I know this would vary, the response that you may give would vary depending on the insurance plans, but the gentleman is asking if, in your experience, does insurance typically cover these types of devices, and if so, which type?
Yeah, so I would say generally no. Insurance only wants to cover what's medically necessary, and you all have probably made that argument for so many things in your lives already on what's medically necessary, and what we think is medically necessary isn't what insurance believes is medically necessary. So for the most part, TENS units, NMES, and FES, for a lot of people, it's not covered by insurance. You can always get a physician referral and go through the process and try, but I cannot tell you that it will be very successful.
Okay, that is the last question.
Awesome.
All right, and we are spot on. Thank you so much, Jennifer. Again, just 2 more points to everyone. You'll get a copy of this recording probably on Tuesday morning in your email. So look for that, and we'll also let you know Jennifer's next session, which is going to be 5 weeks from today. And then I think that's about it. So thanks again, Jennifer. Thanks to all of you that joined us. Enjoy the rest of your weekend, and thanks for continuing to tune into these sessions. Again, they're really made possible by the grant that we received from the Reeve Foundation. So we're grateful to them, and thanks again, everyone. Enjoy your day. Thanks, Jennifer.
You're welcome.
Okay, bye-bye.